Yes, sir. So I'll give you just a quick background. I'm a wounded veteran. I'm a two-time Purple Heart recipient.
Wow.
Literally, I had shrapnel go through my head. I've been blown up. My issue is when I speak to practitioners inside the VA and out, there seems to be a lack of understanding because my testosterone levels will be all over the place. They've tested at 180 before. They've tested at 550. Even when they're at normal ranges, I still have issues. I still have erectile dysfunction, loss of libido, lack of motivation, lack of energy. I'm obviously been treated for PTSD as well. So my question is just is there literature out there that maybe I could take to a practitioner? Because there just seems to be sort of a lack of understanding whenever I speak to a physician.
Oh boy. First off, my heart goes out to you, sir, and thank you so much for your incredible service and to be a veteran, not to mention a wounded, veteran, and just the healthcare guys, the first responders, everyone that we work with, Bill and I and Andrew, we always prioritize you guys. So it's hard.
Every day is Veterans Day on the
Yeah,
Anabolic Doc app.
yeah,
Testosteronology.
damn, that's awesome, man.
Thanks, I appreciate that.
Yeah, it's awesome. So, I work with the VA. A lot of my patients currently, my private patients, are either law enforcement, military, or first responders. So I work with a lot of VA guys. I'm just trying to think how, the VA, again, I don't want to disparage the VA and start bashing. It's easy to talk, right? But there's a limited resources in the Veterans Administration hospital systems and medical systems. They have a lot of patients and a lot of people, including women, that have significant medical issues they have to deal with. So I know I've heard from the caregivers in there, Doc, we want to do everything we can for this guy, but and in your case, maybe you're kind of one of those people too, because you may have some serious injuries, right, and PTSD. So the problem is they have an overwhelming abundance of a problem. They also don't know what to do with. You have to be like dead for a lot of them to treat you, but it's changing, and depending on your healthcare provider in the VA. So two responses in the VA, or maybe get out. Like I told the other guy, get out to someone else. So I go to another healthcare provider. So if you're in the VA, the only thing you can do is say, I don't know of any data. I'd have to look for some data on this, but I don't think there's going to be anything that we're going to come up with. It's going to be here's the amazing, study that's going to convince them. It's not going to be there. We know that if we know that you're not a number anymore, you could see that from endocrinologists, I believe at UCLA and other centers of excellence where but if you're 500 or 400, they're going to say, come on, man, that's like, you're not, if you're 300, maybe 400, and you're young like this other man, like that's unethical not to treat. But they don't know that. They don't know that. So because there is a study that recently came out scaling and this, you could go to Google, low testosterone scaled by age, 2020, recent, or so. You'll see there's a study. I forgot where it was. I see a lot of studies every day, and it did give credence to looking at younger men, saying that if you're young and you're 400, that's equal to a guy who's older, who's like 200 or 250. It was there. Someone did a great research on that, some research. So, but if you're all over the board, maybe it's because of your brain injury, your pituitary, your hypothalamus. And then you could say, beyond that, do I have to show you guys low numbers? Because you could just take like birth control pills and but that's like unethical. Guys do that. They'll take estrogen pills. The guys will do things to show low numbers, even send like, I don't know, maybe a friend they know of has low T. I've seen everything. But you should be able to say, I'm low enough that androgens help men that have disabilities and that have PTSD. It does. There's a lot of data for that. You could find that data. You could just Google it and say, here's the studies. And say, I really need this. because it's like a psychotropic medicine, you know, because I know, and we don't want to put them down and say, oh, they'll give you painkillers, benzodiazepines, anti-anxiety, anti-depression, medicines that make you dead, you know, that kill your libido, but they won't give you testosterone, right? I mean, we're not going to go down that rabbit hole. But it's like, maybe you could say to them, a caregiver that you really trust, and they're not going to lose their license, but maybe they're going to feel like maybe they will get and the politics, they're not going to. So if you can't do it in the VA, get outside the VA. There's a lot of healthcare providers that are testosterone experts that we're working with. Again, we're going to have a directory. You got to give us a month, you know, at least a couple of weeks. We're going to have a directory, and you could go to one of these healthcare providers, and they're being trained by me, and you could go to them, and they will help you, because you need to have a trial of testosterone therapy. If I was taking patients, I have so many men like you that testosterone has been wonderful for. But you have to get it, right? Someone's got to believe in it. Someone's got to write that script for you. You don't want to get it from the underground. You want to get it somewhere. Does that answer your question, sir?
Yeah, for sure. Thank you so much for that. Because that is the issue I have is, you know, my numbers will come back and they'll be low. And I say, well, try diet and exercise. Well, I mean, I already do that. I don't drink. I've never touched any drugs. But then they come back, they're, you know, it's 550. No, yeah, you're good. But, you know, I'll sit there and tell them, like, no, I'm not good. You know, I feel this, you know, every day. You know, you can ask my wife, you know, there's just no interest in sex there whatsoever. You know, and I have, you know, been diagnosed with TBI and, you know, traumatic encephalopathy. I mean, I had 13 roadside bomb exposures, and your brain just doesn't hold up to that.
I don't get it where they won't give testosterone. This is like going to be, sooner or later, it's almost going to be a lawsuit. I don't want to fish down that hole, and it's not a lawsuit right now. I want to be very careful. I don't want to get shot or lose my license for saying something like this. But it's unethical not to treat you. It's just absolutely like, what the hell are they doing? But it's like, you know, it's like dragging the horse to the water. You're not going to make it drink. If it ain't drinking, you got to go somewhere else. Have you ever tried testosterone? Have you ever tried it?
I haven't, and I want to, because, you know, I see a psychiatrist and they throw pill after pill at me, and I have to go back and say, I don't feel like crap. I know. It's not working, and now I've got to go through withdrawals. And, you know, I've got coworkers that are like, dude, you need to get on TRT. Like, it, you know, because I also work in EMS, so, you know, my coworkers also experience PTSD, so they've gone on it. They're like, this is a miracle for me. But they're also in their 50s, and they're like, yeah, my physician said they wouldn't touch anybody younger than, you know, certain age. So that it's sort of just this deadlock. Like, I keep running into, you know, the numbers issue.
You need to go. That's why this country, thank God, we have alternative resources with nurse practitioners that are supplying good resources with testosterone. I mean, there are some terrible places that will give you whatever you want. I mean, but why wouldn't you go to one of these places? One of these. You got to go because you're suffering, and I know, and from my experience and in my heart, that it's with the grace of God. Hopefully, it's going to be something good. It's not a guarantee. It's not a guarantee, but it's hopefully going to be something that's going to really be incredibly helpful to you, and that's worth a trial. That's worth a trial because it's a psychoactive medication. I mean,
we have more clinical trials that show positive outcomes on this. That is when it will be more widely accepted to use for mental disease states and so forth. So until then, and the lack of patient education, unfortunately won't be any. But that's what we're changing, Doc. Right,
we are changing it. But we use data.
Well, I appreciate it.
Don't stop battling. Yeah, don't stop battling because we're going to have, that's why we're here, and our chief operating officer is here too, Bill Marshall. He's working with me, and he's just been wonderful. We're growing this app. Wait till you see what we have coming out. It's been a lot of work for about, I don't know, 7.
Stay with us. You're safe with us.
We're gonna direct you to a healthcare provider in America that is going to be able to help you. Yeah, we're going to find one for you. Don't worry. And they're going to be trained by me and with Bill's here and with Andrew, because we're ethically correct, because we have an attitude, at least I have an attitude about it, I guess, chip in the shoulder. I don't know everything, but it's like you're going to have an opportunity to be on androgens and see if it helps you. It could be a miracle, but in my life, in my words, in my experience, more or less not a miracle, but something very important. But then you're going to have to, you're so young, you're not that young. I mean, 39, I thought maybe you were 25 or 29, but Jesus, you're old enough.
Where are you located?
Holy shit.
We got somebody already for him, Doc.
We got someone for you already. We have providers that we've already trained already, and we're working with, and we have one of our first states was Colorado.
That's easy.
All right, sir. Thank you so much.